All right. So I'm going to go ahead and share plaintiff's exhibit B, the amended notice of deposition of Dr. Michael Yablick, taken today at 4 p.m., starting a bit early. This is taken for all purposes under the Civil Practice Act, including for use at trial. We'll record the Zoom video and play that video at trial. So if you'd go ahead and swear in Dr. Yablick.
Okay. Dr. Yablick, if you would raise your right hand for me, please. Do you swear or affirm to tell the truth in this matter pending before us on the 11th day of May 2021?
Yes, I do.
Okay, the witness is sworn.
Thank you.
And I think we have to put this on the record that the parties agree that the court reporter and the witness are not in the same room. And so therefore the parties have agreed that the witness can be sworn outside the physical presence of the court reporter.
Plaintiff agrees. Thank you, Kevin.
Yep.
All right. Dr. Yablick, would you state your name for the record?
Michael Yablick.
And what's your current occupation?
I'm an ophthalmologist.
Where do you currently work?
I work in Sun Prairie, Wisconsin with Davis Dordine Eye Care.
And at all times relevant to this case, did you practice medicine in Chattanooga, Tennessee?
I did.
And are you currently licensed to practice medicine in Tennessee?
I currently am.
Where do you live currently?
I live in Columbus, Wisconsin.
And in 2018, was Mr. Harrison Zelaya your patient?
Yes.
How long have you been an ophthalmologist?
I have been practicing since 2015, so almost 6 years now.
Do you have an active ophthalmology practice in which you see patients throughout the week?
I do.
Are you on call at times for trauma center?
Yes.
What does it mean to be board certified in a particular field of medicine?
It means that you have undergone adequate residency training in that particular field, as well as I would assume in most fields, undergone some kind of examination testing, general knowledge in that field. Those are generalities from ophthalmology, at least.
Are you board certified in ophthalmology?
I am.
Could you tell me a little bit about your educational background?
Sure. I did undergraduate work at Millsaps College in Jackson, Mississippi, where I received a bachelor's in biology. Subsequently did my medical training at the University of Alabama in Birmingham at the medical school there. I did a year internship in Montgomery, Alabama in internal medicine, 3 years of ophthalmology residency in Richmond, Virginia, and an additional year of fellowship training in New Orleans, Louisiana.
I'm going to go ahead and share what I've marked as Plaintiff's Exhibit 62. Dr. Yablick, is this an accurate copy of your curriculum vitae? Go ahead and scroll slowly through it.
Sure. That looks like an up-to-date copy, yes.
Right. And I'm going to go ahead and tender Dr. Yablick as an expert in the field of ophthalmology.
No objection.
All right, Dr. Yablick, I'm going to ask you some opinions today. Will all the opinions you give be to a reasonable degree of medical certainty?
Yes.
So first, I'd like to ask you a little bit about Mr. Zelaya's medical treatment. In addition to providing medical treatment yourself, have you reviewed some of his medical records?
I have reviewed some of them, yes.
And what can you tell us about Mr. Zelaya's initial appearance at Erlanger Hospital ER on July 4th, 2018?
So he presented, it looks like from an outside hospital with a concern for globe injury after what he stated was a fireworks injury. He presented to the emergency room with trauma to his left eye, and that was what led them to call me for the initial consultation. Upon
You know-
evaluation, it looked like, yes.
Sorry. I'm sorry to cut you off. Go ahead.
No, I was going to say he had an eyelid laceration, and it looked like his natural lens had been displaced and had some vitreous hemorrhage, which is bleeding inside the eye. And so the CT scan showed some concern for a globe injury that needed to be checked in the operating room. And his eyelid laceration was extensive enough to warrant repairing it in the operating room as well.
I'm going to go ahead and share Plaintiff's Exhibit 61. Is this the CT scan that you just referred to with the globe damage?
Yes, that is the report.
And I think you just alluded to it, but what did the CT report tell you?
Well, the CT report suggested that there was an injury to the globe with a possible rupture, that there was vitreous hemorrhage in the eye, which is basically bleeding in the back chamber of the eye, and that the lens was misplaced into the front of the eye.
Do you know if Mr. Zelaya could see out of his left eye on that July 4th date?
I believe I documented no light perception, which is basically no vision on initial consultation.
And after you saw Mr. Zelaya, what were your diagnoses?
So I had a diagnosis of a left upper eyelid laceration, left lens subluxation, which is displacement from its normal location, a left vitreous hemorrhage, and then increased pressure inside the eye.
Did you perform surgery on Mr. Zelaya?
I did.
What type of surgery was that?
So there were basically two parts to the surgery. The first was an exploration of the globe to rule out any globe rupture or injury to the wall of the eye. And the second part was to close the eyelid laceration.
Was there a debridement of the tissue as well?
Yes, so the what appeared to be some necrotic or dead tissue was debrided from the eyelid laceration.
I'm going to share with you what I have marked as Plaintiff's Exhibit 63. This top diagram here, is this a reasonably accurate diagram of a human eye?
Yes, it is.
And this bottom diagram here, is this a reasonably accurate diagram of a human eye?
Yes.
I'm going to go ahead and tender Plaintiff's Exhibit 63 into evidence. Can you tell us about the surgery you did on Mr. Zelaya? And feel free to use this diagram to explain.
Sure. So the globe exploration that I mentioned involved cutting the conjunctiva, which is a clear covering over the white part of the eye, or the sclera. Sometimes lacerations are not visible through the conjunctiva, which is the reason for looking underneath of it. And so after removing or kind of separating that conjunctiva to explore the sclera, I didn't see any visible globe ruptures or any indications that there could be one in the eye. And so the conjunctiva was sewn back into place in its normal location. The second portion of the surgery basically involved reapproximating or putting the edges back together of the eyelid laceration. I did, during that process, remove some foreign material as well as cut out some necrotic or dead tissue from the eyelid and surrounding areas. And then the various layers of the eyelid were placed back together or sutured back together in its normal anatomic location.
Did you have some difficulty closing Mr. Zelai's eyelid?
Yes, there was a little bit of difficulty just from the swelling that was in the eyelid. It made the skin tighter than it would be otherwise. And so it just took a little bit extra attention to basically reapproximate or close the eyelid wound.
During surgery, did you notice anything about Mr. Zelai's lens?
In the microscope, I could tell that the lens was actually in the anterior chamber, and you can refer to the diagram there. So it had been displaced forward in the eye, and that was what was actually causing his pupil to be a different shape than normal. But I didn't enter the actual eye at all, so that's basically all I could say from just the closer examination under the microscope.
Did you notice anything about Mr. Zelai's retina during surgery?
There was some tissue in the front of the eye that was visible that I thought was likely to be retina, which means it appeared to be detached from its normal location.
I'm going to stop sharing this, and I'm going to share what I've marked as Plaintiff's Exhibit 64. Do these appear to be true and accurate copies of your medical records relating to the surgery you performed on Mr. Zelai? And I'll go ahead and scroll through these very slowly. That's the last page.
Yes, so that's a consultation and operative note from the hospital. Yes.
I'm going to go ahead and tender Plaintiff's Exhibit 64 into evidence. How long did Mr. Zelai stay at Erlanger Hospital after the surgery?
I believe I saw an admission date of July 4th, 2018 with a discharge date of July 7th. So about 3 days.
And did you see Mr. Zelai after the surgery for follow-up appointments?
I did. I saw him for several visits in the office.
Do you know how many visits you saw him?
I believe I have 3 here. And that would have been July 9th, July 12th, and August 6th.
Was Mr. Zelai in pain during those visits?
He was in varying degrees of pain during each visit.
What did you observe during Mr. Zelai's post-operative visits?
So the first visit, I observed that his vision was still basically no light perception or no vision. The eyelid was a bit swollen as expected, but appeared to be adequately closed. The pressure at this visit with treatment was normal. And so that was the first visit. The second visit, let's see. The second visit, he complained about more swelling in the eyelid, with a little bit increase in his pain level. Still no vision, but a normal pressure. And the eyelid laceration appeared closed. And the third visit, which was about a month after initial presentation, his pain appeared to be improving, but I didn't say that it was completely gone. Still no light perception vision. The eyelid looked quite good at that point. Looked like it was healing well. Signs of a little bit of inflammation in the eye, and his eyelid pressure had actually dropped from the previous visits. And so I would say that's a summary of the 3 visits.
Did you make any diagnoses with regard to his lens?
In each of the visits, it appeared that the lens was still dislocated. In the 3rd visit, there was enough inflammation within the eye to prevent a good view to the lens.
And I think you mentioned in the 3rd and final visit, Mr. Zelaya's pressure in his eye had dropped. Can that cause pain?
It probably could under the right circumstances, although not always. It would depend if there was an additional pathology related to that.
Did you refer Mr. Zelaya anywhere?
I did. The first visit, I think it was after the first visit, the patient was referred to both an eyelid specialist, Dr. Melson, who primarily practices in Nashville, but has at the time had clinic in the Chattanooga area, as well as a retina specialist. And I think he ended up with Dr. DeCruz, if I'm not mistaken.
I'm going to go ahead and show you what I've marked as Plaintiff's Exhibit 65. And again, I will slowly scroll through these. Did these appear to be true and accurate copies of your medical records related to Mr. Zelaya's post-operative appointments?
Yes, those are our clinic notes.
I'm going to go ahead and tender Plaintiff's Exhibit 65 into evidence. Dr. Yablick, do you know if Mr. Zelaya's left eye was eventually removed?
I understand that it was.
Was Mr. Zelaya in pain when you first saw him at Erlanger Hospital?
Yes, he was.
Is that pain more severe than just having a piece of dirt in your eye?
Yes.
Can the type of pain a person with eye injuries experience prevent them from sleeping?
Yes.
What happens when the pressure in the eye changes either higher or lower?
So when the pressure in the eye rises, it really depends on how quickly that change happens, but oftentimes with a quick change in the eye pressure, when it increases, it can cause a pretty severe ache over the eye, as well as nausea. When the pressure is low, it most of the time doesn't cause symptoms. Sometimes low pressure can lead to something called a choroidal effusion, which is basically a swelling in the back of the eye that can be uncomfortable.
Does inflammation in the globe cause pain?
Yes.
And does inflammation in the eyelid cause pain?
Yes.
Right. Finally, has Mr. Zelaya been a good patient?
As far as I notated in the record, sure.
And did he keep all of his appointments with you?
I believe so. I don't have information about any follow-up past the 3rd visit.
And he told you the truth as far as you can tell?
Yes.
All right. Is there anything else you wanted to talk about or think we should talk about that I haven't asked you today?
Objection formal question. Objection vague.
Have all of the opinions you've given today been to a reasonable degree of medical certainty?
Yes.
I have no further questions at this time.
Dr. Yablick, my name is Kevin Spanner. I represent the defendants in this case.
Okay.
During your treatment of Mr. Zelaya, during his hospital visit, one of the procedures that you did was to repair the eyelid, correct?
Correct.
And as part of that, you debrided some what you guys described was necrotic tissue from the eyelid.
Yes, as far as I could tell from what I was seeing.
Okay. And then once you debrided that tissue, then you closed the laceration to the eyelid. Is that correct?
Yes.
And then over the course of your subsequent visits with Mr. Zelaya, part of your exam would be to look at the repair that you did to the eyelid and assess it.
Correct.
And if you had noticed any further tissue that needed to be removed, that's something that you would have done for Mr. Zelaya, correct?
Correct. And I also sought some additional help from an eyelid specialist just to be sure that he agreed with my opinions.
Right. And I think you testified earlier that that was Dr. Nelson.
Melson with an M.
Melson, I apologize, Dr. Melson. So you consulted with Dr. Melson to have him review the work that you did in repairing Mr. Zelaya's eyelid.
Correct.
And as I see from your records, it does not appear that Dr. Melson made any recommendations to change any of the treatment that you had done for Mr. Zelaya's eyelid.
Correct. I don't have any direct mention of his reports, but I don't recall there being any change in treatment plans.
So you would agree then that the work that you did to repair the laceration to Mr. Zelaya's eyelid was successful.
Correct.
And you would agree that Mr. Zelaya's recovery from the work that you did to his eyelid was successful.
Objection made.
Correct.
Now, you were asked some questions earlier about pressure changes in the eye, but during the last visit that you had with Mr. Zelaya, one of the things that you noted was a report from him that his pain had improved. Is that correct?
At that visit, yes, it had improved.
And over the course of your treatment for Mr. Zelaya, the pain in his eye continued to improve.
It appeared to initially worsen after the first visit, but by 1 month it had been improving during that period.
And part of the treatment plan that you developed and executed for Mr. Zelaya included drops to instill in the eye. Is that correct?
Correct.
And of those drops, some of them are designed to treat increased pressure in the eye. Is that correct?
Correct.
So some of those drops would actually take and decrease the pressure within the globe of the eye. Is that correct?
Yes.
And as far as pain medications that you prescribe, you ordered Tylenol to treat his pain. Is that correct?
If that's what was mentioned in the record.
Well, if I can, and Morgan, if you'll be kind enough to pull up Exhibit 65 for me.
Sure. You know what page?
This would be page 3 of 6. And doctor, what I want to direct your attention to is toward the top of this page. There's a section that reads medicines. Do you see that?
Yes.
Okay. And I believe this is going to be the second to the last medication. What reads Tylenol, PRN, pain med, PRN. Did I read that correctly?
Yes.
And for the jury, PRN is an abbreviation for as needed.
Correct.
And so what you were prescribing was Tylenol to treat his pain as he needed it, correct?
These were active medications, and so I can't determine whether I had prescribed those or if they were prescribed from the emergency department.
Well, in that same vein, if you thought he needed a different pain medication to treat his pain, whether it's a medication you'd prescribed or a medication somebody else prescribed, you would have prescribed a different medication.
More than likely, yes.
Okay. And so more than likely, then you felt like the Tylenol as needed was sufficient to treat the pain that he was in.
As far as oral medications go, the Tylenol and whichever other pain medication was listed, I suspect he probably didn't have a listing of which exactly medication that he was on, which is why it was left unspecified.
And when you say which is why it was left unspecified, what do you mean?
The term pain med.
So is it your belief that he was on another pain medication other than Tylenol?
Yes.
But you did not know what that other pain medication was?
Correct. It was not noted in the records, so we don't have a definite medication that was.
Is that something that you would normally ask patients is what other pain medication are you taking?
If there was some sort of change in treatment plan, then I would probably want to know what he was taking.
I think that's all the questions I've got.
I just got a couple follow-up. Dr. Yablick, can pain fluctuate?
Yes.
So it can be better one day and worse the next?
It could. Yes.
Okay. I'm going to share with you again plaintiff's exhibit 65. And again, page 3, which was, I think, a record of Mr. Zelaya's second follow-up appointment with you. And here he referenced the Tylenol. And I think you then mentioned this unspecified pain med. Is it your medical, I guess, opinion that he was also on an additional pain medication?
Yes.
That's all the questions I have.
I have nothing further.